Welcome back to the deep dive. Today, we're tackling a really critical topic. We're pulling insights from source material on cervical cancer prevention, STDs, HPV, and, well, the absolutely vital role of education in all of this.
hmm
And look, this isn't just another health topic. We're diving into something that is kind of astonishingly one of the most preventable cancers there is.
It really is.
And yet it remains a major, often fatal challenge, especially, in parts of the world that can least afford to fight it. The sources we're looking at, they take a really comprehensive view, sort of blending global research with practical experience.
That's right. And what's particularly insightful about this material, I think, is that it moves beyond just the clinical perspective. It really gets into the social, the educational, and even the ethical dimensions of preventing these diseases.
Yeah.
It's a much broader look than you might initially think.
So our mission today is clear. We're going to deep dive into these sources, pull out the absolute core insights, and, well, help you cut through the noise to understand what's really most important for preventing cervical cancer and managing risks like STDs and HPV. Let's get into it.
Okay, so the first crucial insight, I think, from this material is that startling fact you just mentioned. Cervical cancer is highly preventable.
And yet, devastating lives. The source points out that while, okay, half of cases are in women aged 30 to 55, the actual cell changes. They can start much, much earlier, potentially even in childhood.
Precisely. And that's why it hits resource-poor countries so hard. It's often the most common cause of cancer death for women there. It underscores this profound global health disparity.
And the source immediately connects this to another really widespread issue, sexually transmitted diseases and infections, STDs and STIs. It really pushes for a proactive stance here, doesn't it? On screening, prevention.
Absolutely.
Yeah.
Because the consequences of leaving them untreated are, well, they're serious. The material details risks like infertility, other chronic health issues for women, and even potentially life-threatening conditions for a fetus during pregnancy.
And there's a practical challenge the source points out, too, the reality for doctors, right? Often not enough time in a standard visit to really talk prevention properly.
Yeah, that's a big one.
So to bridge this gap, the source suggests maybe exploring things like personalized mailings or electronic reminders for the doctors themselves.
Right. It's a reminder that getting crucial health info out isn't just about the knowledge itself. It's also about the practical side, finding ways to make sure the message actually lands, given the constraints we have in healthcare.
Okay, building on that, the source broadens the picture a bit. It outlines what's involved in sexual health overall. It's not just about babies, right? It covers birth control, pregnancy, and, yeah, the whole spectrum of STIs and STDs.
And the source makes a useful distinction there, too. An STI, that's the infection itself. An STD is when that infection actually causes the disease. Not all infections do.
No.
They're typically passed, through sexual contact, skin, blood, body fluids, getting into the body via places like the vagina, mouth, anus, or even open sores. The source says there are at least 25 different types. And symptoms, they can vary wildly, or sometimes you don't get any symptoms at all.
Wow, 25. The list the source gives is, well, it's long. It includes common ones we've heard of: genital warts, herpes, chlamydia, gonorrhea, syphilis, HIV, and the one we really need to zoom in on, HPV.
Yes, human papillomavirus, HPV.
Okay. According to the source, it's just one of the most widespread STDs out there.
Yeah.
Incredibly common, especially among adolescents.
Right.
Now, most people's immune systems, they'll clear the infection just fine on their own. But persistent HPV infection, that's the key problem. That can lead to genital warts, sure, but also cervical dysplasia, those precancerous cell changes, and, critically, cervical cancers. Okay, let's look at specific risk areas the source brings up. It zeroes in on teenagers. It notes quite significant numbers initiating sexual activity pretty young, sometimes 13 or even younger.
And that early start, often combined with, let's say, riskier behaviors, it creates a double risk. It contributes to both teen pregnancy and high rates of STDs. The source actually points out we need more research specifically on what protects and what puts this very young group at risk.
And teen pregnancy itself, the source calls it a critical issue with staggering costs.
The outcomes mentioned are pretty sobering. Teen mothers, less likely to finish high school, less likely to marry, more likely to end up on welfare. And their babies are often born small or premature.
And here's a statistic from the source that, it really jumps out. Studies show 1 in 4 girls and young women is infected with at least one STD.
Yeah.
1 in 4, that just shows the sheer scale of the challenge, doesn't it? Particularly in that age group.
It does. But And the source is clear on this. It isn't only a young person's issue. It actually cites studies showing STD rates have more than doubled among people aged 45 and older.
Period. Double.
More than doubled, yeah. So it affects people right across the lifespan.
Okay. Right. Let's double back them, like you said, and do that deeper dive into HPV specifically, and its very strong link to cancer. What exactly is this virus, biologically speaking?
So the source describes it pretty simply. A small, double-stranded DNA virus. And here's the crucial connection, the really key point. Infection by high-risk HPV types, the source names types like 16, 18, 31, and 45, that infection is considered a necessary cause for cervical cancer.
Necessary. Okay. And cervical cancer, remind us, a second most common cancer globally?
That's right. But, and this is important, the source is careful to add that while HPV infection is necessary, it's not sufficient on its own to cause the cancer.
Okay. So other things have to be involved. What else plays a role?
Exactly. The article lists several cofactors, things like a person's immune status, certain types of contraceptive use, definitely cigarette smoking, and importantly, whether that HPV infection persists long-term rather than being cleared naturally by the body.
Right. Persistence is key. And what about the other types of HPV? The low-risk ones?
Yeah, the source distinguishes those. Low-risk types like 6 and 11, they're mainly linked to genital warts, which are quite common, actually, affect about 1% of sexually active people, but they aren't life-threatening.
Okay.
And the material also highlights something important. As of now, there's no specific antiviral drug that can cure an existing HPV infection.
Which means if your body doesn't clear it, it can just linger.
Precisely. And the source really emphasizes just how strongly HPV is linked to various cancers. It's implicated in, get this, almost 100% of cervical cancers.
Wow.
Yeah. And also up to 70% of vulvar squamous cell carcinomas, that's a type of skin cancer on the vulva, and 60% of vaginal squamous cell carcinomas.
That link is incredibly strong. And a key detail the source points out, which must make prevention harder, is that most people infected with HPV don't even know they have it.
No symptoms often. And this really sets the stage for what the source material focuses on next, prevention strategies.
Right. The article talks about different levels, primary, secondary, tertiary prevention. But it states pretty explicitly that primary prevention makes the most sense.
And primary prevention just means stopping the infection or the exposure before it even happens, getting ahead of the problem.
So what methods does the source explore for that? It mentions circumcision, actually. Cites studies finding it decreased HPV prevalence by about 35%.
Right, and also reduced acquisition of HSV2, that's genital herpes, by 25% in adult men. Interesting data.
Yeah. And then, of course, vaccines. The source notes the two main ones, Cervarix and Gardasil, designed to protect against the 4 HPV types that cause most of the cancers and warts. Yeah.
Recommended for 11 and 12-year-olds, generally. And then catch up for those 13 to 26 who haven't finished the series. And, importantly, regardless of sexual history.
Now, here's a really crucial nuance from the source, though. These vaccines, while they're incredibly valuable, they do not protect against all the HPV types out there.
That's a critical point. They cover the main ones, but not everything. And the source also points out, realistically, the cost of mass vaccination programs can be high, particularly in those low-resource settings where cervical cancer hits hardest.
So it underscores why vaccines, while great, aren't presented as like the complete total solution on their own.
Exactly. They're a major tool, but part of a bigger picture.
And the source lists other tools too, right? Prevention tools, screening methods. Things like condoms, partner notification, the pap test, looking for abnormal cells.
Yeah, and also VIA, that's visual inspection with acetic acid, using a vinegar solution to highlight potential problem areas on the cervix, and the HPV DNA test itself.
Okay, so if medical tools like vaccines aren't a complete shield and they can be costly, what does the source argue is the fundamental path, especially for primary prevention, thinking really broadly?
Well, this is where the source takes, I think, a really significant turn. It emphasizes education and values as the absolute core, perhaps even framing it as, quote, the only one way for truly comprehensive primary prevention.
Education and values. Interesting. What kind of values are we talking about?
The list the source provides is quite thought-provoking. Information, trustworthiness, respect, responsibility, fairness, caring, citizenship, and this idea of co-responsibility with society. The argument is basically that you need ethical values to guide your choices in this really complex area of life.
Okay. And the source goes into some detail on these. Honesty, truthfulness, sincerity, playing by the rules is called the most fundamental. Integrity, acting on your beliefs, not just what's convenient. reliability.
Mhm. Avoiding conflicts of interest, upholding dignity, autonomy, accountability, self-control. It's quite a list. And trust, the source notes, is built fundamentally on that honesty.
Right. So how does the proposed education strategy fit with this? How do you teach these values in this context?
The strategy proposed is pretty ambitious. It needs to be step by step, it argues, and for every age group, kids, teens, adults, and delivered in every possible setting. Home, school, university, clinics, hospitals,
Everywhere.
everywhere.
Mhm.
The point being that understanding sexuality and its risks isn't a one-off lesson, it's a lifelong process.
And the approach suggested sounds quite practical,
Talk.
talk-based, right?
Yeah.
Explaining actions and their consequences very clearly.
Yeah, making accountability really explicit.
Yeah.
Emphasizing that the consequence of an action is your responsibility. The source also suggests using, digital tools like educational websites, helping people prioritize issues, offering support programs, teaching decision-making skills.
And encouraging open conversations,
But-
talking to others.
Exactly. And this whole discussion then leads into a really challenging societal question the source grapples with, especially around resource scarcity.
The cost issue again.
Yeah. The material asks some tough questions, like, should the cost of dealing with preventable consequences always fall on society? Should there be maybe financial repercussions for risky behavior, like an insurance penalty? It even brings in a quote from Elizabeth Cady Stanton from way back.
What does it say?
The same transgression should be visited with equal severity on both man and woman, which raises that whole issue of unequal societal judgment, right? The source really questions if society must always pick up the tab for individual irresponsibility. And it asks, kind of provocatively, if it's truly impossible to dissuade unsafe sexual behavior. The core argument is that focusing on prevention before things go wrong is necessary because, well, it's far less expensive and avoids crisis situations.
Okay. So let's try and wrap up this deep dive. What's the ultimate takeaway? What's the bottom line this source material leaves us with?
Well, I think the core message is pretty powerful and direct. Primary prevention, stopping the problem right at the source, is the best approach. And it's presented almost as the fundamental, maybe even the only one answer.
Because relying mainly on secondary or tertiary prevention, screening or treatment after infection or disease has already happened,
Yeah.
that becomes vastly more expensive, much more difficult, especially in settings that don't have a really robust healthcare infrastructure to handle it.
So it sounds like the source is basically arguing that, look, medical tools like vaccines are crucial, they're vital support systems, but the ultimate responsibility really lies with individuals making informed decisions, guided by strong values, strong education, and considering not just their own health, but the broader societal impact too.
Precisely. And the source ends with this really thought-provoking juxtaposition. It combines that old quote from Heraclitus, all things are in motion and nothing at rest. Nobody can go into the same water twice.
Right. Life is always changing. With the simple statement, the life is only one. So if life is this constantly changing river, this unrepeatable journey, and you only get one shot, how does the source's emphasis on taking individual responsibility for your choices with clear consequences, how does that shape your thinking about your own health and well-being, especially when it comes to things like cervical cancer, which we know is so preventable?
That's a powerful question to leave people with. Really makes you think about the connection between individual choice and collective health.